Bismillahirrahmanirrahim. Good afternoon, everybody. Welcome to this plenary session. Thank you, Dr. Sania, for joining us here. We're going to talk about the comprehensive policy recommendations for head and spine injury care in lower and middle income countries. It's a joint venture from the World Federation of Neurosurgical Societies, the Harvard School of Medicine, and North Plato School of Medicine. But actually, all the work has been done by Key Park and his team from Howard. So thank you very much, Key. So I'm just going to take you through why do we need recommendations. So we know that these are slides from Key Park that 89% of traumatic brain injuries occur in traumatic spine injuries occur in lower and middle income countries, but we have too few neurosurgeons, and 74% for TBI are needed in LMICs. And look at the traffic, the burden. Look at our helmet laws, that people think that one helmet will protect everybody. We did a study from the Asian Association Society of Neurosurgeons from Peshawar and from Surabaya and India, and we found that the majority of the people are not wearing seat belts or helmets. We also looked at who provided emergency treatment at the scene of the injury, and we found that it was the lay people in majority who were looking, were the first care providers. And then whether a nurse or doctor accompanied the patient to the hospital, no. It was the family, the car, or an ambulance, which has no paramedics available in that. And so we are here talking about a holistic approach to trauma, to neurosurgery. And the duration to surgery, if you look, see that a lot of patients are more than 12 hours to the scene of for the surgery. Rehabilitation we looked at, and these all 3-4 hospitals, we found that majority of the patients were being sent home to the family to look after and give rehab. So there was no rehab care as well. And people think that the barriers are because there's lack of effective political adequacy, insufficient resources, and perception that surgical intervention is not cost effective. So as you know, that the National Surgical Obstetric and Anesthesia Plan was launched in Pakistan, also the first country in Asia. And we were very lucky that we were able to do the Provincial Surgical Obstetric and Anesthesia Plan in Peshawar. So hopefully they will soon become into a policy document. So our work has been going on since 2016, where Key Park presented the Bogota Declaration, which said that we therefore hereby declare global neurosurgery as a collective and unified effort in improving all aspects of neurosurgical care whenever and wherever it is needed. We call on the neurosurgeons as well as their professional societies of the world and related stakeholders to take urgent coordinated action to lead and address the unmet global neurosurgical needs. And this is where then we discussed and we talked, and Key Park decided to work on this to present policy. And these are policy recommendations. These are not meant for neurosurgeons themselves. They are meant for policymakers. And I think we have to push it with our policymakers on this. Thank you very much.